Today we are going to see nursing diagnosis. Let's define nursing diagnosis. Nursing diagnosis, this is the clinical judgment about individual, family or community nursing responses to actual potential or risky health problem by use of NANDA. Remember NANDA. NANDA was derived in 1990, and NANDA in full is North American Nursing Diagnostic Association. So it is acceptable in all world. Every nursing diagnosis was derived by these people. So nursing diagnosis can be in three categories, three forms. So nursing diagnosis can be in actual, potential, or risky. So in actual nursing diagnosis has three parts. So it has the problem, it has the cause, and it has the evidence. So let's give for example, like in this one, let me say for the patient has difficulty in breathing. So in pneumonia or in respiratory distress syndrome or in anything, let's just give for example, and you see how actual nursing diagnosis look like. So, and the patient has difficulty in breathing, we can say ineffective gaseous exchange related to maybe obstruction of the airway or obstruction or secretion in alveoli, all those things, anything that can obstruct airway. So we said as evidenced by the patient labeling to breathe. So in our nursing diagnosis, the problem is the gaseous exchange. The patient is having ineffective gaseous exchange. That is DIB, isn't it? Then what is the cause of ineffective gaseous exchange? We have obstruction of the airway. And then what is the evidence? The evidence is that the patient is laboring to breathe. So actual nursing diagnosis has three parts. Remember, the problem, the cause, and the evidence. So that is for the actual nursing diagnosis. But I can tell you that the problem you can get from the patients, and then you need to know the pathophysiology of the disease. Then you can be able to derive the cause very well. Then the evidence is that signs and symptoms you can get from the patient. Let's go to potential nursing diagnosis. Okay, potential nursing diagnosis. Anyway, I've forgotten something about actual nursing diagnosis. Actual nursing diagnosis is when the problem is there already. and you need to handle the problem. So let's come to potential. Potential is when the problem is not there, but if something is not happen about the present situation of the patient, there is the chance that the other things will happen. For example, like complication. So the problem is not there, no problem. So, and it has two parts. It has the NANDA, that is the risky potential for, it is the same as, so, and then we have the complication that may arise. Like for example, if the person is bleeding, the person is potential for having anemia. So you say potential for anemia. Anemia is related to bleeding. So even in bleeding, the patient is potential to have fat cyanosis. The patient is potential to have cardiac arrest or organ failure if the bleeding is not controlled. So if you are bleeding, does not mean that the person is now having anemia. But if the bleeding is not controlled, the patient will have anemia. And then risky is also the same. The problem is not yet there, but if a person is exposed to a certain condition, the person will be in position to get some problem. Like if you are hospitalized, you are risky to get nasopharyngeal infection. That is the infection get from the hospital, or you are eligible to get pressure showers in case you are bedridden, or you risk at staying longer in the hospital. So those are the three parts of nursing diagnosis.